very much. So I'm going to ask you all to please make out your question cards for our panel. We're going to go around and collect those. While we're waiting to get those, let me ask each of you if you want to respond. And you've all mentioned this. A lot of this is consumer driven. If you could wave a magic wand and give every consumer one bit of knowledge or one bit of information, what would you want them to know that either they don't know now or they're confused about? If you had that magic wand and you could impact all of them at once, what would you like them to know?
I guess I'll take that one. I think a lot of times the marketing claims on packaging leads to consumer confusion. And I'm going to give you an example that is not antibiotic. But we know that 80% of the consumers think that there are added hormones and steroids in poultry. We haven't had that in years. And yet the consumer still believes that. And so the idea that there are antibiotics in the meat is a real confusing thing for the consumers. You've heard a number of the veterinarians talk today already. There's withdrawal period, there's oversight. And so that concept of antibiotic-free meat is really difficult for the consumer. They don't understand that it's truly an animal raising practice and their meat is safe and wholesome. Angie, do you want to?
Yeah. This is an interesting one, and as a scientist, this drives me crazy. We are getting into a situation with our consumers today that I really believe we're headed towards anti-technology. Okay, if you work through that. And so if I could wave my wand, it's not that we should absolutely carte blanche say every new technology comes along, use it however we want to. But can we come back to some fundamental understanding that technologies can improve both our health, the animal health, the product that we use? And if there is a fundamental, I think, support for technologies and the proper use of them, it makes some of these conversations that we're having with consumers, I think, a little easier. Because so many of them are confused today on technologies that they just as soon say, I'm not dealing with all the rhetoric, I'm going to simply walk away and I'm going to choose free or free of products. And I feel better because I don't have to worry about understanding the technology. Now, there's a lot of savvy consumers that have made personal decisions and informed decisions. And we as a company are providing that, that kind of product to those consumers for that. And choice, I love the U.S. marketplace where we're able to offer, choice if the consumer wants that choice. But this underpinning of anti-technology, I think, and anti-science, anti-technology, if I could wave my wand, that would be my piece.
We have a lot of questions here. Does anybody else want to weigh in on that issue or move on?
Maybe just ever so briefly is that I'd like consumers to remember that the animal protein we eat comes from real animals, and that animals just like us sometimes get sick and they deserve to be treated. And that we have on all these treatments, all these FDA-approved treatments, have withdrawal times that ensure that that these medications are no longer in the food that we eat. I think we have I'm very proud to be part of animal agriculture. We produce the healthiest, most abundant, and safe food, I think, in the history of mankind. And I think consumers need to be really aware of the quality, not only the affordability, but the quality of the food that we eat, and that it does not contain any of the compounds that you've talked about, Christine.
We're not going to get to all these questions, but some of them have a similar theme. One of the themes is, with all these changes in agriculture that are happening and that are being driven, at least as we just said, in part by consumer demand, is there a risk of negatively impacting the food supply or the food production system? Is there a balance there, or are we just trying to get the antibiotics out? There are several questions along those lines.
Well, I'll start on it. In meeting consumer demands on what they're asking for, if you don't do it appropriately, yes, you can harm the animal agriculture system. Right? So I think some of the things that we're approaching is in the choice parameter, right? That if certain consumers are asking for choice, we will figure out the best way to work with our production supply chain to assure that we still deliver what they are asking for relative to some transparency or lack of X, Y, and Z or increased nutrition, and do it in a way that is safe and wholesome and can be affordable or at an extra cost, depending on what that change or request is compared to what we have been producing. So we have seen shifts, for years. Right? It just doesn't come in the same way that it's coming today, and we have adjusted our production schemes to meet those technologies and things that have occurred as they have come forward. And we will do the same thing with the requests that are being made of our consumers today. What I think Cargill moves forward with is the mandatory. Right? Right now we will make adjustments on a voluntary basis of meeting consumer demands, et cetera. It's when, for whatever reason, the entire marketplace has to change without the ability to make adjustments, et cetera. So we will make adjustments, we'll move with the technologies or the request to consumers and make sure we do it appropriately as those demands come.
Yeah, I would echo Angie's comments. We look at it almost as a three-legged stool. We know antimicrobial resistance is a global concern, and we want to be part of the solution. We also know that we cannot compromise animal well-being. If those animals do get sick, they need to be treated. And then finally, the third leg is safe, wholesome, and affordable food. If you remove one of the legs of the stool, it gets pretty wobbly. And so we always try to balance the choices of our consumers and customers to make sure that that stool is as stable as possible. But I think we cannot lose focus of the fact that you have to have all three of those. Removing one of those legs is going to be not a very pretty situation for agriculture.
I'll make a comment. It's applicable to human medicine. It's applicable to animal medicine, and that is what's the indication for use. Judicious use means that you use it when it's indicated, and when it's indicated, you need to use it. You need to use the right drug at the right dose for the right duration. And that's why I think we have an opportunity, to really look at indications and say maybe the message to the consumer is raised with judicious use of antibiotics as indicated, as appropriately indicated. So, when I talked about the fact that there are a lot of drugs, prescriptions that are prescribed, some areas more than others, it's not that we want to wholesale decrease the use of antibiotics. What we want to do is decrease the use of antibiotics where it's not indicated. On the human medicine side, they've done a lot of work to say what are the types of infections where antibiotics are indicated and for what duration and what type. That evidence basis is then what you need to gather on the animal health side to say what is the real indication for antibiotics, and that goes to your cures and outcomes issue here that you have. And where the use of antibiotics does not have a good evidence basis, and it may not be indicated, that's where you want to push the decrease in use. So, it works both sides, really. And I would say that given the difficulty maybe in collecting some of the data having to do with the veterinary feed directive, but it may be worth the effort if you were actually to be able to measure that how much drug is being used as indicated. Okay, then you have an evidence basis for the amount of drug, for the type of drug that you use in animal agriculture. And it seems to me that given that that's part of the veterinary feed directive is the indication, you have an evidence basis for using antibiotics for that indication, and then that's what you're aiming for is using the drugs appropriately in the right amounts for those indications.
Maybe just to follow on, one of the really great things about judicious use of antibiotics in animal agriculture is, to start with, we all know it's the right thing to do. All of us value extending the effective lives of these amazing medicines for as long as possible so that they will continue to be effective. But in animal agriculture, since animal agriculture is indeed a business to raise animals for food and to make a profit for those businesses that do that, it's a beautiful connection where judicious use and economic drivers absolutely align. We don't want to use any more antibiotic than is absolutely necessary to make sure that animals remain healthy. So it is, to me, it's a very natural place for animal agriculture to focus.
There are several questions, Chris, about the map that you showed. Now, again, a recurring theme. And you showed Alaska. One of the questions is, does this mean that doctors in Alaska are just better stewards of antibiotics, and perhaps they should go to West Virginia and the doctors in West Virginia should be sent to Alaska?
Yeah, it's interesting as to why exactly those differences really are there. And I think it does have a lot to do with behaviors. We brought that up before. What's the behavior of the consumer? What is the behavior of the physician in their interaction with the consumer? And I think, and I can't go into a lot of reasons why in Alaska it's so low. In California, in general, it's also lower than in the rest of the nation. But what it does allow you to do is, especially when you look at the indications for those prescriptions and you say, what are those extra prescriptions being prescribed for? And a lot of it is outpatient use, and you can imagine all the earaches and sore throats and so forth that are coming into outpatient use. We know that in a lot of these places, up to a third of antibiotic prescriptions are unnecessary because they are used for bronchitis and sore throats and middle ear infections that are usually viral, and even if they aren't viral, they are self-limited. So, but it is hard to deny a mother with a screaming child who can't sleep, and neither can the child, and they're convinced that an antibiotic is going to help them. So, but you can design programs when you know where the injudicious use of antibiotics is happening, what populations it's happening on the physician side, on the patient side, and geographically, to design those interventions of education and when we talk about, I think what's going to maybe drive some of this on the human side and probably on the animal side is some of the information coming out on the microbiome. It's going to be very important for how we discuss the use of antibiotics in the future.
Again, another theme of questions is around the question of there is competition, obviously, in the food industry. There are different proteins. Is there a way of telling the ag story as a single entity with a single set of messages? Or is market-driven competition going to get in the way of having kind of a unified approach to dealing with consumers and other customers?
Okay, so I guess I can take this one
Your
first.
turn to go.
We, like Angie, there's always going to be choices. And we thrive on providing choices for the consumer. And sometimes those consumers will want a higher welfare status or a particular raising attribute. And so it's going to be market. I think the challenge also becomes in agricultural species are very different on how they are grown and raised and oversight. You heard us talk about vertical integration. In some species, poultry, that is a system where we can move the needle quicker because a company can utilize resources to provide new technologies or veterinary oversight or make sure that the feed provided to the animal meets all of the regulatory requirements. If we think about another species, such as the cattle industry, that's very fractionated, especially when you get down to cow-calf operators that he or she may have 5 head. And so it's much more difficult to have a unified message when you're talking about 2-leggers, 4-leggers, and unfortunately we have no one on our table that represents fins. And so that, I think, is going to be difficult to have a unified message other than we recognize the problem, we are striving to solutions, and we have to work in collaboration, hand in hand, with our medical partners and our veterinarian partners.
Yeah, I would agree with Christine. I do think, though, there is an umbrella statement we can move forward. I do believe in all of the species that, and the dialogue, one of the dialogues that you talk about changing from the last roundtable or last discussion to this one is, less folks are pushing back on saying this isn't animal agriculture's problem, right? Antibiotic resistance is only a human piece. There's more people at the table with an understanding that there is a role to play here. And so if we can start under the umbrella that, yes, judicious use is appropriate, and I think all the species can move forward with the message that we do have a role to play in this, and that we need to move producers forward in judicious use while allowing competition to flourish. I mean, that's how companies, we differentiate ourselves, we work forward. I do think we probably need to do a little better job relative to the hundreds of different labeling options and confusion that we are creating. That's probably something we need to work on. But a lot of that's, what that does is that pushes us forward. We are getting pushed by consumers ahead of the regulatory, ahead of the health profession in this space by moving into some of these other options. And so I believe that, that competition is healthy. But I also believe that there's some fundamentals that we can agree on in this space. And then how we implement them can vary because of the different supply systems, the different diseases, and the different treatments that we have. So it's a matrix answer, in the mix. Not the first one that we've ever had to deal with in the ag industry.
Just to add to that comment, in terms of competition in the food industry, as we raise animals, it seems to me, and this goes back to the idea of metrics, if as we start to focus on, if you want to, let's call it health efficiency, so that we can create systems and processes with our larger animals that allow for less use of antibiotics, less use of other specific inputs. Where we create management systems where animals thrive and where disease is reduced. Those are the kind of, for me, those are the kind of metrics that they'll be adopted by animal producers, because they'll see the value in trying to enhance their health management programs. If we focus on, from my own perspective, we focus on metrics that are really just sort of headline type metrics around some sort of reduction in the abstract of this or that. Again, I'll go back to what I said before. I believe that the likelihood of getting good compliance at the production unit level will be greatly reduced. So if it ultimately benefits the animals, benefits those who produce the animals, and benefits consumers, that's the win-win-win that we ought to be aiming for as we think about metrics.
We only have time for one more. We have so many questions. We have time for one more, and it is a theme, and you've started to answer it, so we'll continue with this. You pose some very important questions, and several of the questioners would like you now to answer them. And Roger has just started. One of the issues is trust. In metrics, who is going to be trusted by the different parties, whether that's consumers trusting the data, producers releasing the data, all the different people involved in different aspects? Who are going to be the trusted entities? Who could be the trusted entities to collect, receive, and process this data? Is there any group or person out there who would be sufficiently trusted that they would be accepted as, if you'll forgive the word, stewards of these data? Dr. Braden is here from the government.
There's a couple of things that I think we need to consider, and that is, as Roger had discussed before, it's not easy. The systems are not necessarily out there. The standardization is not necessarily out there, and so forth. And this is something on the human health side, when we talk about surveillance, we deal with all the time. We have to build the system sometimes from scratch. It's not easy, and it's expensive. And so, who's going to do that? I think there's a role for all the stakeholders, really. But who is ultimately going to be able to be the ones that analyze the data and make it public? I think there's a major role in my thought is that the regulatory agencies have a role to play in that. Others could also have their own analyses that they can do. It shouldn't be a data store that is, restricted as to. And I think that goes down to the facilities. Should be able to have information on the data that may be applicable to their facilities, and then of course to the different when you're looking at the different animal groups or protein groups and so forth. But it's going to take quite a bit of effort, I think, and I think it's going to take some funding. Some of that could come from government, but some of it's going to have to come from the industry to make it happen. But I think ultimately, you've got to make it to where everybody sees a benefit in saying what are the types of pathogens, what's the resistance in the pathogens that's affecting my animals or could affect my animals, how effective are the antibiotics that I have access to going to be in those circumstances, and what am I producing that's going to be safe for the consumer? That's as much of an issue for the industry as it is for anybody. And so the data that's got to be generated should be available and analyzed by the different stakeholders for their own use.
Yeah, I think you have to have the appropriate stakeholders at the table to make sure that you get buy-in. If you leave a particular stakeholder out, whether that's an NGO, whether that's a retailer, whether that's a small producer, I think the data will seem, well, I wasn't invited to the table, so it's not accurate, it's not transparent. So everyone has to have buy-in. And that's what makes it difficult. But I think that we need to have the voices at the table today while we're developing the metrics, because if we get them and we forget somebody, it'll not be good.
I think that's absolutely true. Though one other comment maybe that I'll make that I didn't bring out before is that as we seek to develop metrics that are useful both at the production unit level and at the macro level across the U.S., it's very, very important, it seems to me, that we figure out systems that allow us to anonymize the data. So a given production unit, if that unit sees value in collecting data for their own purposes, that's great, and that should be the ideal. But their ability to take that data and put it into a national database, I think, can only occur if we have some type of system that allows for the anonymization of that data. So HIPAA-type rules in animal medicine, I think, will need to be established in order to ensure that we get that kind of quality of data. And I think that will go a long ways toward making the data trustworthy.
Yeah, I think it depends on what data you're collecting and who you're delivering it to as to who you trust, right? So that will vary depending on what data you have. We do have instances in our industry where it's not government data that's trusted. If we do the food safety portion of it, while we have inspectors in our facilities, we have third-party audits under agreed-upon global standards of which people are accepting the third-party audits. And that's not done by the government. And I can do an audit of my Dodge City, Kansas facility, and all of my customers accept it, both domestically and internationally. So there are ways that we can do some private, public type of data collection and of verification of that data that would not have to be solely a government entity being involved in the collection and the dissemination of that data to be trustworthy. So I think there are multiple options here, but I'll go back to what the theme has been. We can't have groups undermining legitimate data collection pieces, and we end up having that an awful lot. The stakeholders need to come to the table, and hopefully our players there, and we do get these private-public conversations and agreements, and then that data can move forward appropriately without being, so much undermined, which a lot of our data sources sometimes today are. So
that's all the time we have.